I firmly believe that the basic grounding of case management is to be trauma-informed care. And to me, trauma-informed care is realizing that when someone comes through your door, they've experienced a life of instances that may or may not have been good for them. As children, a lot of us experience trauma, whether it's a divorce in a family, whether maybe physical or mental abuse. It could be living in a neighborhood that's not unsafe. It could be various other things that cause trauma in a kid's life. And to me, an adult is just a grown up child, right? So we still carry all of those traumas with us. And so understanding that when someone came through my door as a new client or even someone who I knew for a while, knowing that there might be certain things that might trigger them and upset them. Like, for instance, I had a client who he was always triggered by a man who would stand up while he was sitting down. He didn't like it when anyone, especially a guy, would be standing up beside him while he was sitting in a chair, because his father was very abusive to him. And one of the punishments he did was he would make him sit in a chair, and his father would stand above him and smack him in the head. And so he didn't like anyone approaching him if he was sitting in a chair and they were standing up. So I had to make sure that I physically was aware of how I was interacting with him, that I would never stand up while he was sitting down, because that just really triggered some anxiety. Or there's other people who I would always ask them if it was okay if they wanted to work with me as a female, because you never know. Sometimes someone in their life who was a female could have done harm to them, and that may trigger something. And so I'd always ask, well, would you rather work with me or would you rather work with a male case manager? I can find a way to make that happen if you don't feel comfortable working with me. And so there were a couple of clients that said, honestly, it has nothing to do with you personally, but I just don't feel comfortable working with women. I was like, but that's fine. I'll find you a guy who you can connect with. I'm not taking it personally. I understand I prefer female doctors. That doesn't mean that I have anything against male doctors. So just keeping in mind people's histories and really making sure that you accommodate so that they feel that they can trust you and also feel comfortable around you, because then no one's going to fall through with services if they don't feel like they trust you or that they feel like they can be around you and confide in you.